I'm Peter Block here at the American Heart Association annual meeting in Chicago, and I'm here for On the Scene. With me is Anna Axelsson from Sweden, actually now in Boston. Anna's a basic scientist, but actually has done a clinical trial trying to figure out whether or not an ARB is good for some patients with hypertrophic disease. So, Anna, tell me about your study first off.
Well, the INHERIT trial was a randomized trial with losartan, investigating the effect in patients with hypertrophic cardiomyopathy, and the primary endpoint was left ventricular mass. Treatment for 12 months.
Okay, treatment for 12 months is important. So, and you tried to figure out whether or not there would be a regression in ventricular mass. What was the basis of this trial? I mean, is this founded in basic science, or how did this all come about?
Yes, it is. It's founded in basic science. The rationale is that there is no medical treatment that actually that alters the disease progression. But animal models have shown that with losartan, you can actually prevent the development of fibrosis and hypertrophy. So that was our rationale for doing the study.
Okay, so now we have good animal data and a good theory that should work, and tell me what you found.
Well, unfortunately, there was a small decrease in both groups, but there was no difference between the groups in the change of left ventricular mass over 1 year.
Okay. You know, everybody says, oh, well, another negative trial, throw that one away. Now, you, however, in the discussion, because I was at this discussion when you presented, there was a lot of interesting controversy about what this really means. Tell me your thoughts about going forward with this. Is this a throwaway, or what do you think actually is going to happen?
Well, I don't think it's a closed door. I think in this particular population that we studied, which was a relatively unselected population with patients with mutations, without mutations, with all ages of adult patients, we didn't see an effect. But I do think that there's still an open door in investigating subgroups in hypertrophic cardiomyopathy. It's a very heterogeneous disease. And also, as the VANISH trial is investigating at the moment, looking at patients that either don't have hypertrophy yet or that are very young and have developed hypertrophy.
So one of the issues, I guess, here is that if you treat early before hypertrophy becomes severe, this may show some effect with an ARB. Is that a fair statement?
I think that's what we're hoping for, yes.
Okay, well, a negative trial, that's too bad. Nobody loves a negative trial, but I think there's more here than meets the eye. There may be a little bit of smoke left and some fire. We'll see whether ARBs actually make a difference when the patient is started early. Really appreciate you coming. Thank you, Anna.
Thank you.